4 decades since the first HIV cases were reported, a significant number of people continue to die each year from AIDS-related illnesses. Inequalities in access to treatment, prevention services, and education hinder efforts to control the pandemic, according to UNAIDS. Hello everyone and welcome to Our Voices, and as usual I am here with my co-hosts Oriani Tangishaka and Jininiwa. I am Suman Sheikh Oya, and World AIDS Day is being commemorated on December 1st under the theme Take the Rights Path, My Health, My Rights. Our Voices is taking a deeper look into the status of HIV-AIDS, its spread in sub-Saharan Africa, and whether Africa is on the right track to end AIDS by 2030. So I don't know if you look at the numbers. Given all the efforts for the last 40 years by global community, why do you think HIV persisted?
Well, to begin with, I think, it's one of those things that people keep asking themselves, why don't we have a cure after all these years? And the other thing that really bothers me sometimes is to know that Africa remains the continent with the most affected people. I mean, 1/3 of the global population is in Africa that, are infected. And that really still bothers me. And so I'm looking forward to learning more about why that continues to be so. And also the mother-child transmission status at the moment. I'm looking forward to hearing from our experts what they think about it, what's the status at the moment, because it worries me a lot as well.
Well, we are 40 years later. I think this is a new generation. We were born where we saw the outbreak of HIV, the people dying of HIV, the awareness of HIV. Now it's less popular, I guess. Resources have been cut, a lot of resources have been cut, and it's preventable. I mean, it was preventable, but at least it's manageable. So I think people do not see it as
scary.
Or
as a threat.
Yeah.
I think I agree. A lot of awareness advocacy efforts have diminished throughout the years, and because of all the progresses made, I think there might have been a few of relaxation, which we will hear from experts. And what worries me, as you said, Orion, is also, after all the progresses that have been made over the years, now we are seeing rise in new infection rates. So we'll be talking about those in this show. Thanks to medical advancements, HIV-AIDS is no longer one of the top 10 global causes of death, according to the World Health Organization. However, it continues to be one of the world's most serious health development challenges. As UNAIDS says, close to 40 million people are currently living with HIV, of which more than half of them live in Eastern and Southern Africa. WHO data also shows over the last 4 decades, 88 million people have been infected with the HIV virus worldwide, and about 42 million of them have died. Last year alone, close to 630,000 people died from AIDS-related illnesses, and 260,000 of them live in sub-Saharan Africa. Research by National Institute of Health points out to the COVID-19 pandemic slowing down the progress made in HIV-AIDS prevention initiatives in Africa. However, poverty, inadequate medical care, lack of prevention services, and education are also some of the reasons for the high level of HIV prevalence on the continent. On this week's edition of Our Voices, we are discussing how societal inequalities contribute to HIV prevalence and the required prevention strategies that will help end AIDS as public health threat by 2030.
New UNAIDS report shows AIDS pandemic can be ended by 2030, but only if leaders boost resources and protect human rights now. As the world commemorates World AIDS Day on December 1st, the Total Control of the Epidemic, TCE, project in Zambia is focusing on its effort on achieving HIV-AIDS targets ahead of the UNAIDS deadline. Kathy Shorts reports from Petauki, Zambia.
Lozi Zulu has been living with HIV-AIDS for 5 years. She's a beneficiary of a Humana People-to-People program, a project working with communities fighting against HIV-AIDS, malaria and tuberculosis. Zulu got pregnant after testing positive for HIV, but her son is HIV negative. For that, she credits medical interventions that help mothers take life-saving antiretroviral drugs or ARVs to prevent mother-to-child HIV transmission.
I have been living like this for 3 years, almost 4 years. So we go together with my husband to collect our medication. We take PrEP and ARVs together. So I'm very happy we are still together.
Zulu's husband, Joseph Banda, is HIV negative. He takes pre-exposure prophylaxis, PrEP, a medication that reduces infection from HIV, the virus causing AIDS. Zulu and Banda are what is known as a discordant couple, where one partner is HIV negative while the other is HIV positive.
My wife takes antiretroviral drugs to protect her from transmitting the HIV virus. She has to continue taking this medication for life.
Margaret Zulu is a field officer at the Development Aid from People to People in Zambia, or DAPP, helping clients around the community to ensure that they are consistent in taking their medicines. She says field officers and community health workers visit people living with HIV who fell out of treatment to re-engage them and help them form small HIV treatment adherence support groups known as trios.
This program of TCE epidemic control has helped people to have knowledge about HIV, about prevention measures, what to do if we have tested negative, what step they can do, or how they can live positive life when we find the discordant couple.
Mwamba Chunda works as an HIV focal point person with the Ministry of Health at Petauke District Hospital, helping HIV-positive people adhere to their treatments.
We used to lose a lot of clients on treatment. You know, when we share someone on treatment, within a short period of time, they are lost. But we're engaging in the community.
The project involves traditional leaders like village headman Yoram Mwanza to raise awareness in communities about HIV/AIDS prevention and treatment programs run by DAPP.
We started going door to door, telling those who didn't attend the meeting that DAPP has got this very good program and we should benefit from it because what we are learning is prolonging our lives, a good life.
DAPP Zambia is implementing the TCE project in Zambia. Elise Sorensen is its managing director.
We are still saying putting people first. And the slogan in the TCE program is that only the people themselves can eliminate themselves from the TB and HIV epidemics.
The UN's bottom-up approach, combined with high-quality health services in Zambia, aims to move toward the global goal of eliminating AIDS by 2030. Kathy Short, VOA Africa, Petauke, Zambia.
According to UNAIDS, women and girls in sub-Saharan Africa account for 62% of all new HIV infections. Women and girls in sub-Saharan Africa are also 3 times more likely to be infected with HIV than boys and men of the same age. To understand why such gender disparity exists in HIV prevalence, we have invited Anjali Acharkar, Deputy Executive Director of the Program Branch at the Joint United Nations Program on HIV/AIDS, and she is an Assistant Secretary General of the United Nations. Over the past 20 years, Ms. Acharkar also worked with the United States government, leading the largest global health effort in HIV prevention and treatment services. Ms. Acharkar, it's a great pleasure having you on Our Voices.
Thank you. It's a pleasure to be with you.
Thank you so much. So there has been a significant progress in terms of HIV, controlling HIV prevalence over the 4 decades. But it seems like ending HIV-AIDS by the target year, which is 2030, seems to be very challenging. So what are the factors affecting this progress?
You know, thank you so much. And let me just first say warm welcome from Lilongwe, Malawi, where I am right now, where we're really seeing the extraordinary impact of the HIV response here in Malawi, but also around the entire continent of Africa. I think it's important to start there. There has been amazing progress on the continent of Africa over the past 40 years rather. We've seen new infections plummet by 60% since the peak in the mid-1990s. We've also seen AIDS deaths decrease by nearly 70% since their peak in early 2000. And Africa has really been leading the way. But as you say, progress is not success. Countries, while they have made extraordinary progress on treatment, for example, we still see new infections that are skyrocketing. Every year, there are still 1.3 million new infections around the world. And there are still 9.3 million people around the world that are living with HIV that are still in need of life-saving treatment. And the furthest gaps that we see are among the most vulnerable populations. Adolescent girls and young women, as you noted.
Yes, and
key populations and children.
Yes. Ms. Achakar, it's really great to hear from you in this field, how much Africa has made progress. But, you know, when we look at the numbers, Africa is especially and disproportionately left behind in terms of avoiding new infections and or death prevention. Can you speak a little bit about that and why that is we still see that?
Absolutely. You know, one of the main reasons we see in terms of new infections on the rise is that inequalities and inequities still exist. The farthest populations that we still have to reach, like adolescent girls and young women, as you described earlier, they're 3 times at higher risk than their male counterparts. We're not doing enough to reach them here on the continent. Prevention interventions are not prioritized. And what we're calling for from UNAIDS and from the HIV community is really to say, let's create a prevention revolution. Let's use these new technologies and tools that exist, like long-acting prevention options that will reduce new infections, to reach adolescent girls and young women and prevent those new infections.
So without, say, talking about those new infections, do you think it is possible to end AIDS by the year 2030?
When we look at, you know, I'm here for the Global Fund Board meeting, and we look at 3 diseases, HIV, AIDS, TB, and malaria. And when we look across these 3 diseases, the reality is that HIV and AIDS has made tremendous progress, and we're on our way to Sustainable Development Goal 2030, which is ending AIDS as a public health threat by 2030. But we need to accelerate. We're not quite there yet, and if we do not accelerate, we will get further off track and it will get costlier in the future, and inequalities will continue to increase, particularly with adolescent girls and young women. if we don't focus on driving those new infections down.
Okay.
And a big part of that is really making sure that we address gender inequalities, human rights barriers, and other issues that prevent access to HIV prevention and treatment services. If I can just say, as we've released in our report, take the rights path. That is what is required to end AIDS. Thank you.
Thank you, Anjali Ashrikar, Deputy Executive Director of the Program Branch at the Joint United Nations Program on HIV-AIDS, and an Assistant Secretary General of the United Nations, for joining us. We appreciate your contribution. It is now time for a quick break. When we come back, we will further discuss ways to tackle inequalities faced by various communities to end HIV/AIDS. But before we go, we also would like you to share with us your thoughts on continental efforts to eradicate AIDS. Share your thoughts on our social media platform. We are on Facebook, Instagram, and X, and our handle is at VOA Africa. Use the hashtag VOA Our Voices. We'll be right back.
In times of change, when the world seems uncertain and what we hear doesn't reflect what we see, we seek the truth. When we are told only part of the story, we lose trust. In moments of crisis, our dreams, hopes, and wishes for a better tomorrow depends on a free press. At Voice of America, we bring you the stories that people take risks to see. We connect the world and unite it with truth. At Voice of America, we show you the whole picture.
Health, wellness, sport, beauty, medical breakthroughs. Healthy Living cares about your well-being. What are the main health concerns in Africa and around the world? Find out the latest on coronavirus. Connect with our experts and ask them questions.
How long does the virus stay?
Join me, Linor Moudou, in Washington, every week on Healthy Living, right here on VOA.
You're with Our Voices, welcome back. Today we're discussing why there is no cure for HIV/AIDS after 4 decades of medical advancement, and if it is possible to meet the goal to eradicate it by 2030. Before we invite our next guest in Kenya, who is working on improving policies and mobilizing resources against HIV/AIDS, let's hear from another woman from Kenya, Doreen Muracha, an HIV-positive activist who advocates against stigma as a way to eradicate this disease in our Women to Watch segment.
I put short videos of a message of hope that I live with HIV like others and don't fall behind. But the end goal is to reduce stigma, especially self-stigma, because many people are struggling with self-stigma, rather than stigma that comes from society. On Instagram, Facebook, and Twitter, I use short messages of hope so people can use their medicine, educate themselves about stigma, but I don't say it as a motivational speaker would say. I use a lot of jokes because it's my story, and this is what I'm living with every day.
Joining us now via Skype from Nairobi, Kenya is Maureen Milanga, Director of International Policy and Advocacy at Health Global Access Project, or Health GAP. Ms. Milanga has a background in law and human rights and has created the People Living with HIV Manifesto. This is a document she used to urge presidential candidates in Kenya to roll out AIDS treatment and healthcare for all Kenyans. Ms. Milanga, welcome to Our Voices. Thank you. Thank you for joining us, and I hope you can hear us. So more than half of the global infection happens in Africa, and most of them are women and girls. Why such a disparity?
There's a couple of things. So one is primarily stigma, discrimination, and other legal and social and gender barriers. So for example, if you look at the current laws that allow young women, adolescent girls and young women to access services, you see that only 47 countries around the world have adopted policies that require that allow young people to be able to receive services without the consent of their parents. That in itself puts a barrier for young people who require to go and get access to services, and especially young women who need to go to the facility to get access to contraception, to get access to prevention, to get access to services. That's a huge barrier. The second thing that's a huge barrier that most programs have not tackled is the fact that when we think about women and girls, we don't necessarily think of the fact that there are young women and girls and women in general who are sex workers, who are people who use drugs, who are transgender women, and queer women in general. This in itself increases their capacity, their risk of getting HIV, because most of the time they face a lot of discrimination at our healthcare facilities, and there's a lot of denial of services based on who they are or who they love. Another area that has caused a lot of disparity is primarily with regard to gender inequality, gender-based violence, which also is a big increaser of HIV, of the risk of HIV among women. It also causes a lot of death among women. The capacity of women to be able to negotiate for safer sex, to negotiate for prevention with their partners, and the option to use condoms and to use other prevention options is also a pretty difficult thing for women to manage. And so our societies are not necessarily built to allow women to be able to.
Exactly. So can you just expand on the stigma? How does that affect the numbers?
So for example, with services, I will give the example of what we've experienced with our partners in South Africa, working with the Treatment Action Campaign through Rechidze. We have interviewed people receiving services and realized that when people go to receive services, some of the things that they experience is that healthcare workers, if you miss your appointment, you get healthcare workers who are very angry at you. And you come in and you're pushed to the back of the line because you missed your appointment. Some of the times you've missed your appointment because you had to go do other things. You had to go to work, you had to go to school. If you come into the healthcare facility and you're a sex worker, you experience stigma. For example, healthcare workers would call other healthcare workers to discuss the fact that you're a sex worker and the reason why you have maybe an STI that is bringing you to the hospital, or you want to access multiple condoms to protect yourself and to protect your clients. So there's quite a bit of stigma that people experience. If you're a young person and you go into the facility, you'll experience stigma based on your age, because you're going to you want to go and get contraception, for example, and you want to prep. And as a young person, you're 15 years or 17 years of age, and your healthcare worker is asking you about why you're having sex in the first place.
Right. And in addition to the stigma, which definitely is an issue, we still have inequalities. How do you advocate for policies that help to improve inequalities? What are some of the results you're seeing in that work?
When we ask for policies that allow young people to be able to get access to services, that reduces the inequality, especially when it comes to young girls. If those young girls are able to go and get services without necessarily requiring parental consent, that reduces the inequalities that they face. If we change the policies that criminalize sex workers, people who use drugs, transgender people. Then those reduce the inequalities of access to services, especially among these communities, that everybody is able to access services without necessarily fearing that they're going to get arrested, or fearing that they are going to, or fearing that they will be denied that service when they go to the service delivery point. So we are working with ministries of health, and we are working with donors and funders to be able to ensure that the policies that we have follow the science, and that they are able to allow people to be able to, countries to be able to reduce those inequalities, because that makes.
Okay, so Ms. Milanga, do you think Africa has a chance to catch up with eradicating HIV by the deadline of 2030?
There are countries that have made great strides in pushing forward and reaching those goals by 2030. For example, countries like Kenya, Tanzania are walking the path towards reaching those goals. But there will be no country that will be able to eradicate HIV if they do not change the policies that currently exist in their countries that stop others from being able to access services. And there will be no country that will stop HIV without putting in place the resources that are required to push against, to walk the talk of ending HIV and in our continents.
Okay.
I think it's possible. The question will be whether our leaders have the political will to be able to do that, and they will put the resources behind it.
And with that note, we end our show. Thank you so much for joining us and for sharing your perspective. And that's where we end our show. Our special thanks goes to Anjali Acharkar, Deputy Executive Director of the Program Branch at the Joint United Nations Programs on HIV-AIDS and an Assistant Secretary General of the United Nations, and Maureen Milanga, Director of International Policy and Advocacy at Health Global Access Project, or Health Gap. It's a great pleasure having you both on Our Voices. Be sure to watch Our Voices on the VOA website at voaafrica.com or on our YouTube channel, where you can catch up on the latest episodes and the world's top news stories. We also thank our editorial and production team on Our Voices. We will see you again next week with another exciting program. Be sure to continue the conversation on our social media platforms. Until then, thanks for watching.